Okay, let's talk about who might benefit from glycine consumption or supplementation. So a lot of people would benefit, but some of the key categories here: people with obesity, type 2 diabetes, metabolic syndrome, cognitive decline, anxiety and depression, arthritis, osteoporosis, and sleep disturbances. So let's walk through some of the research about glycine. Metabolic impact of dietary glycine in individuals with severe obesity. This was a study where they gave 19 different participants with severe obesity. They were treated with glycine, 100 milligrams per kilogram of body weight a day for 2 weeks. And what they found is that the glycine treatment significantly increased their plasma glycine. We conclude that dietary glycine supplementation reversed obesity-associated glycine deficiency. What they're finding, and I'm going to try to make this make sense for you, is that the act of being obese itself causes glycine deficiency. And if we think about it that way, it's not that even necessarily this person is not eating enough glycine, it's that the obesity is driving the deficiency. There's actually a special enzyme inside the mitochondria that's responsible for helping convert. I showed you some diagrams earlier, but if you're not real familiar with biochemistry, there's probably a lot of it was Greek, but serine turns into glycine, or can be converted into glycine. And there's a particular enzyme that drives this conversion. And what they think is happening is that the act of being obese kind of blocks that conversion. And so you get stuck here. And so if you're not eating glycine and you're depending on the serine conversion, it's not happening as efficiently in obese individuals. So here was the conclusion of that paper when we look at it. So you can see we conclude that dietary glycine supplementation reversed obesity-associated glycine deficiency and enhanced glycine conjugation detoxification reaction, 1-carbon cycle flux, and potentially the severity of MASLD, which is basically liver disease, fatty liver disease. Glycine supplementation should be further investigated as a novel treatment in liver disease, in fatty liver disease. And so again, the dose here was 100 milligrams per kilogram a day for 2 weeks. So it was this relatively short study, relatively small amount of people in that study as well. But nonetheless, glycine supplementation, positive outcome. This is a review paper, highlighted a note here. Glycine plays a role in metabolic regulation, antioxidant reactions, and neurological function. Thus, this nutrient has been used to prevent tissue injury, enhance antioxidative capacity, promote protein synthesis and wound healing, improve immunity, treat metabolic disorders in obesity, diabetes, cardiovascular disease, ischemia, reperfusion injuries like stroke, cancers, and various inflammatory disease. These multiple beneficial effects of glycine, coupled with its insufficient de novo synthesis, meaning the body's not making enough internally from other things, support the notion that it is a conditionally essential and also functional amino acid for mammals. And then the special note here, including pigs and humans. I think that's the one we want to pay attention to right there. But that was a review paper on all the different functionality and research on glycine. And then here's a study on the effects of glycine on subjective daytime performance in partially sleep-restricted healthy volunteers. So what they did is they didn't let people sleep, and then they supplemented them with glycine before bedtime. They gave them 3 grams of glycine or a placebo. And what they found, glycine modulates certain neuropeptides in the suprachiasmatic nucleus, the SCN, which is part of the brain, and this phenomenon may indirectly contribute to improving the occasional sleepiness and fatigue induced by sleep restriction. So in sleep-restricted individuals, 3 grams of glycine helped them have more energy and feel better and perform better. Here's another study on humans where they used 2 things. They didn't just use glycine, but they also used N-acetylcysteine, NAC. And if you aren't familiar with NAC, go watch my crash course on NAC as well. But what they found, supplementing glycine and NAC in a combination improved all these defects, and when they stopped taking the GlyNAC, all the problems came back. So this was actually a washout trial. The results of this trial suggest that GlyNAC supplementation could be a simple, safe, and effective nutritional strategy to boost cellular defenses to protect against oxidative stress, correct mitochondrial defects to improve energy availability, increase muscle strength and cognition, and thereby promote healthy aging in humans. And so you can see here at the top, you want to screenshot this. These were the outcomes in this study and how they measured different things. So they found that it improved glutathione, and it reduced a byproduct of DNA breakdown, and it reduced certain types of inflammatory chemicals. They found that it improved mitochondrial energy production, and they found that it reduced many of the chemicals responsible for inflammation, like interleukin-6, TNF-alpha, and C-reactive protein. They found that it reduced blood sugar and it improved insulin response. They found that it reduced certain chemicals that lead to vascular inflammation. They found that it reduced this chemical that's responsible for DNA damage, and they found that it improved gait speed. In the walking test, it improved their grip strength, and it improved their cognition. So that's a lot of benefits for 2 amino acids. Now, I have a theory about this. Now, these doses were equivalent to quite high amounts, but my theory on this is because this study was done in elderly people, and I think this is true a lot about a lot of the trials where they give high doses of amino acids. I think that our population is so protein deficient. When you give high dose amino acids, I think the benefit is so powerful because they're so protein malnourished, and their body's just grabbing that building block and it's going to work with it. Now here we have this on glycine as well. This is another review. Conclusion, glycine has a wide spectrum of defending characteristics against injuries and disease. Oral supplementation of glycine with proper dose is very successful in decreasing several metabolic disorders in individuals with cardiovascular disease, various inflammatory diseases, cancers, diabetes, and obesity. Glycine holds an enormous potential in enhancing health, growth, and well-being of both humans and animals. Okay, let's talk about some of the metabolic problems. So this study in humans on glycine and insulin resistance. With that, again, a common trend that is found in people who are obese is that the act of being overweight or obese, what they find is glycine deficiency. And this is despite diet. They just find low levels of glycine when you're overweight, when you're obese. So you can see plasma glycine level is low in patients with obesity or diabetes, and the improvement of insulin resistance increases plasma glycine concentrations. In prospective studies, hypoglycemia at baseline predicts the risk of developing type 2 diabetes, and high serum glycine level is associated with decreased risk of type 2 diabetes. So the higher the glycine, the better to an extent. Consistently, glycine concentration is lower in the lean offspring of patients or parents, rather, with type 2 diabetes compared to healthy subjects among patients with type 2 diabetes. Hypoglycemia, which sounds like this is low levels of glycine, occurs before clinical manifestations of the disease, but the pathophysiological mechanism underlying glycine deficit and its potential clinical repercussions are unclear. The role of glycine maintaining collagen structure is critical, as glycine residues are required to stabilize the triple helix of the collagen molecule. This quality of glycine likely contributes to explain the occurrence, was what I was talking about earlier, of medial arterial calcification, so plaque buildup in the arteries, and the elevated cardiovascular risk associated with diabetes and chronic kidney disease. So glycine tends to be low in these individuals. You look at this as a human study that came out of China. Patients with so there's association with serum glycine levels with metabolic syndrome in elderly Chinese population. So patients with metabolic syndrome have lower glycine levels than do normal subjects. What's more, The association between glycine levels and metabolic syndrome is more pronounced in very old people than in younger old people. Our study emphasizes that it is significantly essential for the elderly population to maintain a higher glycine level in the serum. So therapeutic application. I think if elderly would eat more protein, they would get more glycine as well. I think that's part of it. You can see here effects of glycine on metabolic syndrome. This was a review published in 22. Available evidence shows that the amount of glycine synthesized in the body is insufficient to meet metabolic demands in people with metabolic syndrome. Plasma glycine levels are lower in subjects with metabolic syndrome than in healthy individuals. Interventions such as lifestyle modification, exercise, weight loss, or drugs that improve manifestations of metabolic syndrome remarkably increase circulating glycine concentration. I'm going to stop there for a minute because I think it's important to elaborate. What they're saying here is that if you have metabolic syndrome and you change your diet and you add exercise, by default, and change your diet as in eat to lose weight, not necessarily eat a bunch of glycine, but eat to lose weight, you can improve your glycine levels by default. In other words, there's an inflammatory mechanism whereby glycine production internally is inhibited when you have metabolic syndrome. And I want to point this next diagram out in that regard, because what they're showing here is they're showing liver disease. And so what you can see in this blue section here, this is a healthy liver. This in the red is a sick liver. And so remember, I've shown you this. Glycine converts to serine and vice versa. And this is through a specialized type of enzyme called SHM2. And you can see here, this group of researchers reveal enhanced serine synthesis via reversed serine hydroxymethyltransferase 2 activity in hepatic steatosis. What does that mean? That means in people with fatty liver, those people have enhanced, they use up or burn up their glycine to make serine at more rapid speeds. So they're getting rid of glycine in favor of serine when they have fatty liver disease. And this is what I'm talking about. When you have metabolic syndrome, you most likely have fatty liver disease. The mechanism largely is probably that you're getting rid of your glycine to make serine. Your body is preferentially favoring that mechanism. So uncovering a mechanism for the commonly observed glycine decrease in metabolic dysfunction associated fatty liver disease. This restricts glutathione synthesis and causes acetaminophen hypersensitivity. So think about it like this. They're getting into the weeds biochemically, but I'll draw you some pictures here. When you're burning through your glycine to make serine, because you have fatty liver and your body, this is just like, it's like a genetic shift. Your body activates this enzyme, it amplifies it when your liver's fatty. What's left is you don't have enough glycine. Your glycine levels are low, and so what is one of the functions of glycine? It's to help you make glutathione. As I showed you earlier, it's one of its primary functions. And what does glutathione do? Well, it's the master antioxidant in the liver. So if your glycine stores are being depleted, your glutathione stores subsequently can follow. Now, you take that same patient and give them acetaminophen. What happens? They're more prone to hypersensitivity, or for that drug to cause damage to themselves. And so, here we've had this here recently, all this news about acetaminophen and autism. And I showed you earlier about glyphosate mimicking glycine and disrupting glycine, and children with glyphosate exposure have higher rates of autistic disease. And then there's been research about hypersensitivity to acetaminophen increasing the risk for autism. Is it that it's this mechanism, right? Or is it in part this mechanism? In one nature, we're eating so poorly that we activate the digression of our glycine, so we reduce our glycine levels. On the other hand, we're consuming foods that are super high in glyphosate, and glyphosate is displacing glycine, and so the proteins that are required to be made by glycine are being inhibited to a certain extent. It's so interconnected, and this is why glycine is such a central, important amino acid. I hope this isn't going over too many of you in terms of complexity. Now, you see here in their conclusion, glycine supplementation improves various components of metabolic syndrome, including diabetes, obesity, hyperlipidemia, and hypertension. In the future, the use of glycine may have a significant clinical impact on the treatment of patients with metabolic syndrome. Why in the future? Because there's not money being siphoned to funnel into research to study glycine more effectively, but the research that's there shows that glycine plays a critical role here and can be used, even though the studies are small scale, but the ones that are there are very positive. Here's another one on glycine-based treatment, ameliorating fatty liver disease. You can see here non-alcoholic fatty liver disease, including NASH, has reached epidemic proportions with no pharmacological therapy. Lower circulating glycine is consistently reported in patients with fatty liver, as I just showed you why. Glycine-based treatment attenuates experimental fatty liver by stimulating hepatic FAO and glutathione synthesis, thus warranting clinical evaluation. So the benefit of, and FAO, by the way, is fatty acid oxidation, so it reduces that. Enhances the liver's ability to deal with things, basically. Now, let's look at some of the other benefits of glycine. There's a couple of studies we'll talk about where glycine metabolism in skeletal muscle. You can see here, supplemental glycine protects muscle mass and function under pathological conditions. There have been studies where they show that glycine supplementation, if a person's trying to fast or cut calories, by supplementing glycine during the fast, especially if you're doing a prolonged fast, it leads to preservation of muscle mass. So interestingly enough, those of you that are attempting that, you might look at glycine as a potential ally if you're trying to maintain your muscle. Recent studies demonstrate that supplemental glycine effectively protects muscles in a variety of wasting models, including cancer cachexia, that's the wasting of cancer, sepsis, which is infection, and reduced caloric intake. The underlying mechanism responsible for the effects of glycine remain unclear, but likely involve receptor-mediated responses and modulation of intracellular metabolism. Again, it's always the line, right? Future research is necessary or needed. They just don't do enough of it. Not enough funding. And we have here, this was just kind of a review on glycine as an enhancing agent for physical performance and recovery. Cell and in vitro and animal studies suggest that glycine enhances protection against muscle wasting by activating anabolic pathways and inhibiting proteolytic gene expression. Proteolytic means the breakdown of protein. Some evidence indicates that glycine supplementation may enhance peak power output, reduce lactic acid accumulation during high-intensity exercise, and improve sleep quality and recovery. You can see here in these research papers, glycine's role in muscle protein synthesis and protecting and tissue repair, as well as its anti-inflammatory effects to facilitate quicker recovery, less muscle soreness, and enhance physical performance. Okay. I thought this was an interesting, now this is an animal model study in mice. And so what they did is they induced fatty damage by feeding mice poorly. And so what they found is that in those mice that they caused leaky gut, so that basically this is a leaky gut study, glycine supplementation enhanced the intestinal barrier and ameliorated inflammation and insulin resistance in high-fat diet-fed mice. These effects of glycine were associated with reduced ER stress, that's endoplasmic reticulum stress inside of the gut cells, related to apoptosis in the intestine of obese mice. So basically, glycine supplementation strengthened the intestinal barrier in mice who were eating poorly. Does that translate to humans? As the authors of that paper will say, we need human studies to see if there's a therapeutic role of glycine in human disease models. And this one was actually interesting too. Estrogen-like osteoprotective effects of glycine in vitro and in vivo models of menopause. So these were basically mice studies as well, where they were using glycine, and they discovered that it has an estrogen-like bone protecting effect in these mice menopause models. Therefore, we suggest that glycine may be useful for the treatment of menopause. Now, what's interesting also about glycine is it as a folk remedy. It's sometimes used for women who have hot flashes or severe menopause symptoms. One of the things that glycine helps to do is it increases or improves heat loss in the periphery, in the skin, in the blood vessels of the skin. So, when a woman has a hot flash, all that heat is building, and then that hot flash sets in. Well, what glycine, and it's been shown anecdotally, I've seen this be the case, where it's very effective, very helpful for hot flashes. If you've ever struggled and you've tried the traditional things for hot flashes like black cohosh and borage oil or Vitex agnus castus or clover, a number of different remedies for it, you might consider glycine as it improves that heat loss through the skin. And what we see, many women report that they have less severe hot flashes when using glycine. And to do this is like a 3 to 5 grams prior bedtime. But it's a very inexpensive way to see if you can improve your quality of life, and it's very safe. There's no danger in glycine supplementation in terms of major side effects.